We're at a crossroads as a society, I feel. We're amid many epidemics. We're amid an epidemic of opioid overdose. We're amid an epidemic of hepatitis C infection. We need to decide at this point whether or not we are going to choose to accept people as they are and to create interventions that accept them, or if we are going to continue to punish people for who they are and what they do, continue to grow mass incarceration, continue to isolate and stigmatize people and push them off into the corner of society instead of embracing them as part of it.
Oh, I don't feel comfortable going there myself. If you would go with me.
Yeah, I can totally escort you.
Because I feel like that she is treating me differently because I'm a drug user.
We're spending a lot of like tax dollars on deceased, current people from deceased, where we should be also investing money on prevention. Safe consumption spaces, harm reduction, needle exchange programs. These are all preventions.
Prohibitionism has been a traditional approach to drug use, and we know that that didn't work, and we've seen it continually fail us over the course of history. Harm reduction has evolved with the use of different substances and with the creation of networks and capacity building. So as a community of harm reductionists, we continually are able to make recommendations for each other and learn from each other. And one of these instances is safer consumption spaces. This is something that's existed for over 30 years across the world. We have research from Europe, we have research from Australia, from many other countries that show this is a proven effective method.
All these deaths that we're seeing right now, these are all things that could be avoided. Like if we were able to have safe consumption spaces and we were able to give people a space where they could actually get educated and we could prevent a lot of the things that we're seeing, it will actually work. And we'll see less people having Hep C, less HIV transmission, less death caused by overdose.
I can't speak good enough for a supervised injection facility of this. I had an instance where I had a possible overdose, and unfortunately, I had to be transported to a medical facility to receive, Narcan. With the fentanyl coming in and stronger analogs of fentanyl, people don't have that time. So again, at the safe injection facility, everything's there. The medical staff, the life-saving drug, the life-saving techniques. Really, it's win-win, really.
What we have in here is a model SIF. It's not a place that we allow safe injection. This is actually a room that we demonstrate. If we have any politicians or anyone who is interested in learning more on safe injection, we're able to bring them over to our safe consumption space, which has a stainless steel top. They would come in with their substance of choice. They would receive a tray with all of their injection materials, and there would be a nurse standing behind them, giving them instruction and teaching them how to inject safely. Once the person is done, they're able to discard of all their materials here in the sharps container, and then they'll be able to come and hang out in the chill room. And this is where they'll be able to actually engage in any counseling, or if they want to just hang out and just spend some time within the room.
Under the supervised injection, you have, you have time, whereas the alternative is, a public bathroom where you don't have time. It's very, you got to worry. It's people knocking on the door, could be police, this and that, or outside, in cars, basically an unsafe place. Me, I had caught a nasty epidural abscess. Basically was from missing, and whenever I didn't have the time to locate a vein properly, I would just get it in there, pow, And after doing this with enough with enough, dirty street drugs, I would get, abscesses on my arms.
Once a person is actually here in the safe consumption room, then what happens is that we're not bringing any injection materials into the community is one thing. So there's less risk of any children playing with any syringes or any syringes littering the street. It also allows for a more sanitary environment for injection. Currently, if anyone is injecting because of the stigma for it, they're going between cars, they're going in an alleyway, there could be fecal matter in the vicinity. This basically allows them to come into a space where everything is sanitary, everything is clean, and also it allows them to engage with any primary care or any health care afterwards once they're done. Injecting in a safe consumption room actually can reduce the risk of any bacteria entering into the bloodstream or under the skin, which can cause abscesses or infections. Being here would allow not only for sanitary, but also coaching through that. So if someone injects in one site, they're able to be coached by a nurse to inject in another site, or just to be more sanitary in handling with their works. So it reduces the risk for hospitalizations, emergency room visits, and primary care and all.
We want to have a place where people are going to be treated like people, not like a pest or a nuisance, that they could be seen as somebody that by themselves, not because they're somebody's daughter or son, or no, because they are worth it. It's not going to be just a place where they're gonna use and then run. No, they may come, settle, talk to people, talk to a counselor. If they have something on their mind, share it. Even use the phone, talk to their family. Beginning with just a hello, acknowledgement of that person, where maybe that whole day they have been walked by without nobody saying anything to them.
At Vocal New York, we're an organization that advocates for people who use drugs, for people who are homeless, for people at the intersections of many health and social inequities.
You okay, man?
Yes, thank you.
Okay.
We have 2 different sharp containers in the bathroom, just to like have it out there for people to safely dispose of their sharps, right? These are sharp containers that people cannot get into. People will not be able to reuse any sharps that are in there. Once the sharp is in there, it's fully disposed. We have gloves at all times in the bathroom. The door has a buzzer system where we're able to buzz if we ever need to get in here for an emergency. Can you guys buzz the door, please? Because that's the buzzer system. So anybody that's in here, if they're not able to answer or open the door, we're able to get in here and buzz the door open, and we'll get in here able to do whatever we need to do, whether it is administering naloxone, if it is using the ambu bag, if it is monitoring the person's oxygen level. But this is just a bathroom. It's not a safe consumption space. This is something that we did out of the necessity to try to avoid all the death that we're seeing in our community. This is not the answer. Having a bathroom is not the answer. It's one thing that we needed to do because we were tired of seeing our brothers and sisters dying.